What's the difference between baroreceptors and chemoreceptors? Well, it's fairly simple. Baroreceptors are going to be monitoring pressure. And the most famous baroreceptors we have are in the aortic arch here and in the carotid arteries in the carotid sinus. So what they're going to do is they're going to monitor blood pressure. And when blood pressure goes away and we're having a decrease in our blood pressure or increase in our blood pressure, they're going to send signals to the central nervous system in order to invoke change. That's what baroreceptors do, is monitoring the blood pressure and monitoring pressures. Chemoreceptors are a little bit different. They're going to be monitoring chemicals, and the most famous ones are going to be monitoring CO2 in order to determine should we increase our respirations or decrease our respirations. That's happening in the medulla. Medulla kind of runs all along the back here, and this is the pons hump, and this is the midbrain. So in the medulla, it's going to have chemoreceptors that are going to determine CO2 levels, and if CO2 levels change, they're going to invoke a change typically in the respiratory rate in order to either get rid of CO2 or retain CO2 in order to normalize the acid base.